Nicole Deli Paoli, welcome to Green Pill. First question, will you take the green pill?
Yes.
All right, I didn't tell her that in advance, folks, so I really surprised her. All right, Nicole is the founder of Women Empowerment Counseling outside Tampa, Florida. They see telehealth patients all in Florida, number of clinicians there. She has a master's, she has a licensed mental health clinician license. She has an MCAP, which is a master's in addiction practice. So she helps folks who are experiencing addiction, and that's a specific certification beyond just the basic LMHC. And she has a QS, qualified supervisor. Um, what we're going to talk about today, and we'll see where the conversation goes, is how trauma informs our entire experience as an individual, especially how one can feel better and deal with the the repercussions of trauma in a holistic way. So not necessarily by defaulting to pharmacology, but by focusing on lifestyle, on emotional health, on mental health. Of course, given Nicole's organization, we will focus a bit on women, but we're going to figure out how Nicole got here, what made her do this, and what makes this her life mission. So, how did you get into becoming a therapist yourself?
Yeah. So, I mean, to be honest, it was always between law and psychology for me. And I think what interested me in law, right, was wanting to help people, wanting justice for people. And then just realizing that you can't heal through external sources. It's really internal healing that has to happen, right? And so that kind of led my shift over more to mental health and psychology. And I also think that every helping professional, no matter what type of role they play, have their own journey that led them to the field too. I know I have my own story. It's how I can relate and have empathy for a lot of my clients is just my own journey and my own story that led me here too.
Well, you are keeping us on the precipice and really, really holding back. So please tell us what brought you to helping, what made you get into a helping profession, and what injustice did you suffer, if I may?
Well, so yeah, no, I mean, I think it's really common and also misunderstood, right? So passion for trauma obviously comes from somewhere. So I've experienced some of my own childhood trauma, and then as I grew and developed and learned more about the field, and as I became more educated in what I'm doing and experienced more, you just learn so much more about generational trauma as well, and so wounded parents and what that does to someone, in addition to some of the other things. So yeah, I mean, I've also experienced repeated grief throughout my life, and I don't think I was raised Catholic, so I'm Italian, I'm Catholic. There's a certain way you deal with grief, and it's just not the healthiest way to deal with grief. So I think there was always a lot of unresolved stuff in my life, and when I started learning even more so, I can go back to high school classes, so sociology and psychology, and like, oh, this makes sense. I understand this now. And really, I've always been motivated by understanding the why behind things, which is what leads to the underlying part of my practices, root causes and healing stuff. We're not just addressing symptoms, we're looking at how do we heal root causes so they don't keep manifesting in different forms. And that's definitely been inspired by my own life experiences for sure.
And and so when you say root causes for folks listening, that's you could be a loss early on. It could be, some intergenerational story that, perhaps parents were immigrants and they had it really rough, and or maybe you could expand a bit. What do you see as or what are root causes in the literature, and how do you see them? Yeah.
Yeah, well, so pick a topic. Let's say depression, since that's really common, right?
Hmm.
And I think you and I briefly touched on this once before. Most
Hmm.
recent research shows that depression really isn't a serotonin issue. So when you're exploring, okay, what could be a root cause for depression? Well, do you feel purposeful in life? Do you have a spiritual connection? Are you working a job every day that you hate? That's going to take a toll on you. What does your nutrition look like? Are you exercising? So we know things like being low in iron, low in vitamin D, low in vitamin B, all can look like depressive symptoms for women, hormonal imbalances, being on birth control or hormonal contraceptive birth control. All of these things can contribute to depression. And so I think this is where that term, I think medication resistant depression comes into play, because if you're taking an SSRI and it's not a serotonin issue, sure, you're going to be resistant to seeing improvement in symptoms for sure. So that's a brief example of what I mean about just root causes, is what is really going on under the surface, instead of looking at the individual as a symptom. Oh, you are depression, you are major depressive disorder, I'm going to write you a script for that. What
Hmm.
else is really going on? What does your day-to-day life look like? What kind of connections do you have with people? What are your social supports? The other lifestyle pieces like diet, exercise, nutrition, spiritual connection is huge. I mean, there are so many people that I think that have struggled with depression who don't even have connection to self, let alone purpose in the
God.
world. So, yeah, absolutely. Whatever
And
that is for them.
right, and it doesn't. I mean, you were raised Catholic. It sounds like, and
Not a
so you're
Catholic
talking about
now.
not a Catholic. No, no, and thank you for elucidating that. That's like
Yeah.
important to you, right? And
Yeah.
was there first, obviously, with my background, as folks might know, holistic health, lifestyle, adjunctive services as a support for someone's mental and emotional health. So I had a lot of mental health issues growing up. My mom was schizophrenic. I was anxious. I had, some real mood up and down shifts, especially as a teenager. And for me, after my mom passed when I was 17, finding health, running, yoga, eating much better, solving my gut health, working on sleep, working on my confidence, working with a therapist, I realized that all of those practices supported my mental health, decreased my mood swings, allowed me to cope and deal and be better. And also really leaning into what gave me confidence, so like working in business, being entrepreneurial, finding some purpose, starting a business, like not
Hmm.
avoiding what my heart was desiring. And so I'm totally with you with this root cause approach. Not everyone has the benefit of having met the therapists and clinicians that I have and had the privilege to have good insurance to meet them. And not
Sure.
everyone has yet had the benefit of meeting you. So today, we'll talk about some of the practices folks can take home with them. Um, was there a like a journey for you around some of these, I almost think about them as like 360-degree pieces, like that brought you to the point of understanding, like, or was your training first in traditional psychotherapy?
Well, sure. I mean, you're absolutely trained traditionally, right? When you're going to school and you're getting your master's, and then what you have to do post licensure. I joke with my interns that I oversee about how just you need to learn how to take the state exam, but that's not really what practice looks like, right? So you're going to
Mm,
answer a question on the exam, and that's not what it looks like in real life a lot of the time, unfortunately. So
mm,
we're human. We're not really this case study, and that's where the other piece of a holistic approach is just understanding the human element here, and that all parts of us are interconnected. You're not a symptom, you're not a diagnosis, and just really understanding all those other pieces. But I think so. My own personal stuff led me to the field, and then I worked for about 10 years in community mental health and substance use and high levels of care. So PHP, which is called partial hospitalization. So pretty much outpatient all day long, every day of the week, 5 days a week, residential levels of
hmm
care. So 24/7 programs. And despite all of these services and wraparound services, what I
hmm
saw is people weren't getting better. They just were not
Wow.
getting better, right? So you have this traditional medical model approach, which is what is the symptom you're experiencing right now? And here's medication, or solution focused or coping skills therapy, without actually healing the root cause. I'll speak specific to substance use, for example.
hmm
Substance use is a symptom of something greater. It's not the problem itself. So if you help someone get clean, people don't always
hmm
don't understand, well, why does someone relapse? So if they've been in treatment for 6 months and they haven't
hmm
used, why are they so drawn to using? Well, because
hmm
they were using to cope in some other kind of way. So have we resolved what that is? And what I've seen in substance use treatment is let's focus on staying clean
Hmm.
and fixing symptoms right now. And so I think root causes are going to manifest in other ways. Now, don't get me wrong, I understand that approach too, because what's going to kill you today? It's not going to be your
Hmm.
trauma. It's going to be, the needle in your arm. So I get the safety first approach, but I think we need to go past that. We need to look at what else is happening here. So it's, symptom of something greater. Same with anxiety, depression. Maybe you can relate to this personally. Those shouldn't be diagnoses themselves because they're symptoms of something greater. So, what is it a symptom of? What is happening that's causing this anxiety? You stating that you had a schizophrenic mother tells me you experienced childhood trauma, period.
Of course.
Without even
Yeah.
having further conversation. I already know that because that attachment that you needed from your primary attachment figure, your mom, probably was, not there for you, not secure in the way that you needed it to be at no fault of her own. But so, absolutely, that tells me that, sure, it doesn't shock me to hear you had anxiety and mood stuff.
Totally. And you're hitting nail on the head because it's that, she's angry one day and then she's really nice the other day. And she's having thoughts that are really, you know, unprompted and not connected to reality. Like she would say, "Oh, the neighbors are throwing trash on our lawn," and I would say, "Well, what evidence do you have of that?" And I was like 9 years old. And she's like, "Well, I just know they are." And she'd be like, "Well, I can read your thoughts, mine." And she said, "I think you're having gay thoughts." Hmm. I'm like 9 years old, so of course, it was tough to argue with
Yeah,
her and scream. But um, like with that example, if I had come into a psychiatrist's office when I was 19, I actually do remember he put me on SSRIs, and they really didn't work. And then I cold turkeyed myself off them, and he didn't like that either. He's like, "I think you should go to the hospital. You're having suicidal ideation." I said, "Well, yeah. I mean, I just cold turkeyed these meds. Of course, I'm having suicidal ideation." And he left it there, and it wasn't just our first meeting. It was like a few meetings. There wasn't that curiosity to get into why. Um, Now, my main therapist did have that curiosity, and so I'm with you on the root cause because once I figured out that disordered attachment, once I figured out, my immigrant parents had a certain outlook on life,
yeah,
which ended up
yeah.
driving a lot of stress for me to achieve. Once I figured out all that, then I didn't have to react in the same way to life because I put things in their proper place. And so the addict, not dissimilarly, is using for succor to feel better, to soothe, right? And the fact that you did 10 years, with really tough cases with folks who are really suffering, and then you went to build women empowerment consulting, says a lot about your knowledge of what actually works and what doesn't. And now I understand why you really default to root cause. So it makes a lot more sense.
Yeah, and to clarify, I mean, so I have like what I call my three-tiered approach at our practice because I think that not everybody's ready to dive into root causes, and maybe willing to recognize some of the things. It's really hard to accept, oh, I was abused by my mom. I didn't recognize that that was abuse. Or, this was my role. I played a role in the distress in my life. So it's hard to admit some of these things and recognize some of these things, right? So I think, we're absolutely going to help you with what are the symptoms you are experiencing? Here are some real life coping skills. Let's work through stuff. Let's figure out how to implement things into your daily life, meeting the client absolutely where they're at. If someone isn't
Hmm.
stable enough, you can actually do more harm than good by jumping into trauma work because it's not
Hmm.
easy emotionally to go through that stuff, right? So it's just recognizing what does this person need today. So how do we help stabilize? How do we help teach coping skills and ways to manage what they're experiencing while also exploring and trying to identify the unresolved stuff. Um, and then the third piece is really I call them action steps. We always encourage our clients in between sessions. We give them things to work on. That's really where the change is going to happen. It's not going to come just from the therapy session. It's going to be what are you doing differently in between in your life day to day. And I'm sure you've seen this in your own work with clients, right? You make a recommendation. Are they doing it? Are they not? And if they were, how would that change their outcomes? And so it's what can they also work on in between sessions to enhance therapy. So that's kind of, so I understand the need for all of that. I'm not saying we're only going to, like every client that comes in, we're going to, let's talk about your deep, dark secrets if they're not ready to go there. But it's that gentle confrontation, that therapeutic confrontation. So it's my job to be the objective lens looking in. So if someone's talking about their history as we would during an initial assessment, and then they tell me these presenting symptoms that they're having, I'm going to start linking things and wanting to
Hmm.
explore that. And it's my job to say, have you ever considered that maybe this is why this is happening? And really just recognizing that the client truly is the expert in their life, not me. I'm there
Hmm.
to offer this feedback, and then they're going to decide what they do with that. But yeah, so I think it's a combination of both, really. How do we help you feel better today while also figuring out what is the root cause here?
And and so some of the today, the quote unquote today activities are the exercise, nutrition, the
Yeah.
lifestyle, holding them accountable to that, which I know we've discussed. And also, so I guess it almost sounds like in your three-tiered system that you lean towards something feeling better, this week, like how can we get better this week? And then as it opens up and that, as we work on it, let's get to the deeper stuff because that's ultimately going to really change your whole mindset. Like you'll stop needing to destroy yourself, or hurt yourself or get in your own way. Is that kind of fair to say as a summary? And did I miss
Yeah.
any pieces there? Hmm.
Yeah, I mean, other than just the stuff to work on in between. And an example of that could be something like, let's say someone's really struggling with emotional reactivity. And really what's
Okay.
happening is you're being triggered, right? And I
Hmm.
know in traditional approaches, it's avoid triggers, stay away from them. Especially in the addictions world, it's avoid people, places, and things because we don't want you to relapse. And while, again, that
Hmm.
makes sense maybe from a safety standpoint, if someone hasn't built the
Hmm.
skills yet to be able to cope with it, but in reality what we want is people to experience triggers, because that's like we have a small window when your subconscious is showing, and you can actually change that narrative for yourself, right? So how do we, in that moment, what do you do when you're triggered is really powerful. Are you falling into the same pattern, or are you recognizing that you're triggered and you're intentionally doing something different? And so that's where you start building, new pathways in the brain and changing the attachment to the trigger, right? The trigger is just an emotional attachment to something. Anything can be a trigger. And we want to, through repetition, desensitize to what that trigger used to mean while now creating new meaning for what that really is. So, in tangible terms, let's say,
Hmm.
and I'll use substance use again, it's just easy to understand for
Sure.
people, I think, but let's say a spoon was used in preparing and using your substance of choice. So
Hmm.
now a spoon is a trigger. So you're in early recovery, and how do we detach that? Well, in the moment, if you're triggered by it, you find a spoon in your car. Okay, what do we do now? Well, you need to use some coping skills like deep breathing, cold temperature, other things to calm your central nervous system and get back to a calm state, while also that internal dialogue in your head of a spoon is used for cereal, a spoon is used to feed myself, to bake cookies as I'm mixing the cake batter. Like, what else can we attach to the meaning of a spoon, while also learning how to calm the body reactions? So, mind and body, which is also part of the holistic approach, is that mind body connection, and looking at both of those pieces and how they're interconnected.
Hmm. Hmm. And continuing with your example, person with a spoon finding an old spoon in the car, which probably wouldn't belong there unless it was used for
Mm-hmm.
crack cocaine or something, for crack. And let's just say, so your recommendation to such a person, and for folks listening, maybe they can use parallels to this as we wind this thread through other situations, is, well, first, let's before you even ran into the spoon, did you sleep okay, or were you up late on your phone? Did you wake up and get some morning sunlight? Did you nourish yourself? Um, and then once you encounter a trigger, whether it be this physical object, or we'll give some other examples, some calming of the CNS, some parasympathetic promoting behaviors like breath work,
Yes.
like
Hmm.
perhaps tapping, and I'll ask you some other ones that you like, some recontextualizing in the head. Um, and then following that, of course, more care supporting behaviors like exercise and going to work or calling a friend, which I know is, big in the recovery community, calling a sponsor, and then coming to therapy that week and perhaps discussing it, right?
Yep.
And so I
Yep.
like how you think about things, if I'm with you, as a whole day approach, as a whole week approach, or as a whole lifetime approach. Of, well, why am I in addiction in the first place? And then maybe even a few lifetimes back, which is, well, I had, this story in my family, or maybe thinking many generations back, where we say we have a genetic predisposition towards substance abuse when stressed, which some people do. Um, Maybe you could walk us through some other examples where we could draw that thread for folks.
In regard to how to manage the trigger, you mean?
Yeah, yeah, maybe like an individual, a person rather than an object. You could give an example, like what comes to mind for me is like a tough relationship where someone's with a boyfriend or girlfriend who, the dynamic's not great, and there are some triggering words or triggering situations, but they're together, they live together. How do you
Sure.
counsel someone there?
Yeah, so well, I mean, that could be a very long answer because I think
Do it.
our attachment stuff, right? So going back to that
Mm,
childhood stuff and that connection, if you, let's say, didn't have secure attachment throughout childhood or had some emotional trauma, you're going to bring that with you into your relationship. You don't change. You're going now into this relationship. So when things aren't well in a relationship, it's two individuals usually projecting their stuff into the relationship and not the relationship itself. That is the problem, right? And what I've seen, and I can think of a current couple right now, I see the
hmm
client individually, and then she's also receiving couples counseling, and then her partner's
hmm
receiving counseling. They both have complex trauma histories. Um,
hmm
and they trigger each other without realizing that that's what's happening. Now they realize it, right? And they're doing something about
hmm
it. But before it was just, is he not doing enough for me? Is she not giving me what I need? And just really misunderstanding each other. And a lot of what was going on was they were triggering each other's trauma without realizing it. And so I think, how do you handle that as a couple? Well, insight is always where it's got to start. So if you recognize something's going on, talking to an objective person, trying to gain some insight, resources, reading stuff like, some psychoeducation, but really realizing that most relationship issues are our own stuff being projected into the relationship. And now it's not to say there can't be toxic or unhealthy traits, but then it's are both people. I think the main thing to look for in a relationship is, does this individual that I'm with use self reflection and have insight and have a goal to always continue to self develop and grow? Because if they do, and you point out something to them, then they will self reflect on it and try to do things different and recognize what's going on. And so I think it's really important that we're getting into healthy relationships. And looking for some of those key factors in a partner, if that makes sense. So that's like a very short answer to something that's
hmm
really complicated, because relationship dynamics are really hard. But the thing that doesn't change, like I said, is you're the one going into it. So if you've got unresolved stuff, you're bringing all the stuff with you.
Yeah, you're bringing it on like baggage, as they say, huh? And
Yeah.
can people still show up in relationships with unresolved stuff?
Absolutely. Absolutely. And part of my approach to trauma, and our clinicians too, is if I'm working with an individual who's working on their own trauma work, like I said, it's really important to know that they're feeling safe in their life now, and that they have that emotional support. Otherwise, we can do more harm than good. And so it's not uncommon for me to bring in their support person. So if they are in a relationship, would they be willing to have a joint session, and not couples counseling, a supportive session for the individual, to say to the partner, like, hey, these are some of the things that we're working on, and here's how you can support this person as they're
hmm
going through this. And it's important that you understand, so you don't internalize and take some of this personally. We don't want the relationship to be negatively impacted, but this person's about to rip all these band-aids off, and it's not going to be
hmm
nice, it's going to be messy. And so how can you help support? And so I think asking the person to support, but also giving them the knowledge so they don't internalize it as an issue within the relationship or a reflection of them, if that makes sense, right? So let's say we're working through
Hmm.
sexual trauma. Someone might not be wanting to be sexually active in the relationship during that period of time while they're working through something. We don't want the
Hmm.
partner internalizing that I'm not attractive or we're disconnected or what else is going on. So it's how do we support each other through these processes?
Hmm. And so, it's the answer sounds like yes. Like if somebody, the answer sounds like we all have baggage. Many of us have trauma. Certainly we all have life experience, and there's no perfect state of Alex or of Nicole to be ready to be in a
Absolutely.
relationship, and that's a little more flexible of an approach than you see in substance abuse recovery, which is kind of, yeah, no people, place, or things that remind you of a substance. And it does make sense with that, short-term desire to be clean and safe. Um, when it comes to being safe in relationships, it's about self-regulation, right? And it's about, open conversations with a partner. And like you said, we could spend a lot of time on this, for sure. Maybe a good segue would be couples therapy. And has it crossed your desk? Has it have any of your clinicians working on it? And how do you define couples therapy? Is it the relationship here and then the individual and the individual? That's what I've heard before. It's a lot
Yeah,
of
so
questions, but
I know, I gotcha. I'm following you.
good.
Yeah, so we do couples counseling, and some people really enjoy that and prefer that. So we have clinicians that specialize at that, and I've done couples counseling as well. And it's again, like I said, most times it's two people projecting their stuff into the relationship, and so I think a collaborative approach is really important. So what is the couples counselor recognizing? And a lot of times there is a recommendation for, hey, you go work on this an individual session and you go work on this an individual session, and then we'll do some kind of maintenance couples counseling to help with
Mm.
communication and other stuff. But I think all three clinicians that are working now with this unit should also be collaborating, and I think that's a piece that gets missed. We should be
Mm.
working together. So like if I'm the couples counselor and I see that there might be some attachment stuff happening between them, it would be okay and actually preferred for me to reach out to those individual counselors and say, have you guys explored individual attachment and childhood trauma with both of these? Because it seems like that might be what we're seeing here in this dynamic, right? So I think it's important to collaborate. The clinical staff should be collaborating.
Hmm.
And yeah, it's not uncommon. Like I said, we as the individual are in the couples, we're in the couple. So um, you've got to work on your own stuff too.
Do you feel like there is a third group in a pairing, like a husband and wife, and then the relationship itself? Is that how you see things?
Sure. I mean, yes, because we'll think about humans. We all have relationships. What changes within your relationship between a friend and a parent and a romantic partner or your colleague is going to be the boundaries. You as the individual stay the same, but what you allow someone to show, how deeply you connect with them, those boundaries that you set is what changes between all these different relationships. So the relationship itself, that dynamic there, is its own thing, sure. And what we often see is people get stuck in these negative attachments to each other. So if they're not communicating, if they're not repairing after conflict, now you're
Hmm.
attached this negative thing to that person, and it just can build resentment. We really need to be resolving things, and so it's very common to see poor communication. An example is, how many people do you even know, maybe in your own life, that you've come across that address conflict by saying, you've done this, you make me feel this way. No, no one makes you feel any kind of way. You choose to feel how you want to choose, which I know is really hard for people to hear, and it's not a popular opinion, but it is true. If I come and approach you and say, I feel this way when
Hmm.
XYZ, you're going to be
Hmm.
more receptive to hearing what I have to say because I'm not coming in and blaming and attacking you for how I feel, if that makes
The,
sense.
like the I message that I think you're sharing. I feel this way when, and I learned this in first grade, and my mother
Yep.
actually was really big on, if you feel like there's a conflict between her and I, or my sister and and I, or we would have to write small letters to each other or to like the person, and we'd have to go say like I feel this way because. So even with her mental illness, she was very, and maybe because of it, and partially just who she was very in tune with getting
Mm-hmm.
the stuff out. Like, don't let it bottle up. She would always say, like, it bottles up to here. I have to say it. And actually found that so useful for my future relationships. So I'm with you on the iMessage. I do have a bit of a wrinkle on that question. I'll tell a small anecdote. Like when I was in college in 2011, I was in like a graduate anthropology class. I was probably 19. I probably had no business being there really, but I kind of got into this class and forget if there was a cute girl sitting across from me or somebody, but somebody was like, I felt anxious in the class, right? And it was like a seminar style square table. Again, I was really young. And I went to my kind of spiritual advisor at that time, who was also leading a kind of a spiritual class that I somehow got in, which was really cool. And I said, hey, I feel like when I'm in that class, she makes me feel this way. And she says, Alex, you make you feel that way. And that really did a big reorient for me. And later, I've learned about, we hear about these mirror neurons and we hear about how we actually can impact the neurobiology or just the feelings that others have by eye contact or not eye contact, by proximity, by non-proximity, by tone of voice. You could even talk about pheromones or signals, nonverbal signals. So what I'm asking you, Nicole, I don't know where I'm going with this, but I just think it's interesting, like that. I guess where I'm going with this is like I am responsible for how I feel, but now I used to like stick to that, and now I'm like, well, people do impact me. Like if my girlfriend comes in and she says, "I fucking hate you, get out of my life," like that's gonna impact me. It is my response to it in that Buddhist way. So has
Yes.
your thinking evolved on this question?
So, I
That's where
mean,
I'm going
not
with
that
that.
there aren't things in life that are hard to handle. So I'm not
Hmm.
suggesting that like we're choosing to be upset all the time, that there are not going to be things that affect us. Energy is real. We know this when we look at science. And so if you're around someone that's negative, you're going to feel more negative. If you're around someone that's positive, you're going to feel more positive. So if there is like this, if there is something negative that's happening, it is easy to feel that way. But not only does spirituality show us this, but so does CBT, so cognitive behavioral therapy, right? That it's not the situation itself that actually causes us the distress, it's our thoughts about it. So if in that example, if your girlfriend says that to you, are you able to say to yourself, well, she's really dysregulated right now, and that's an over emotional reaction. So when she's in a calmer space, we'll be able to talk about this and there'll be a solution. Or oh my god, now I'm losing my relationship. What have I done to upset her? What role am I playing? How can I fix this? And you go into kind of panic mode. So you see the
Hmm.
different responses. So not saying that it's not a difficult situation, you're not going to feel difficult, but or
Right.
feel some more challenging emotions there, but how you perceive the situation is your thoughts about it is actually what connects to how you feel. Do you agree with that? What do you think?
Hmm. I think there is a pause when you receive a stimulus like that. And I think you called it a subconscious window. And I'm not, I can't speak to the science behind it, but I think there is a pause where you have a chance to interpret something before you react. And I guess there's sort of the old brain. I hear about the amygdala and then the prefrontal cortex, which is kind of top down regulating of response. And so if you're really scared or you're really interested, your body will almost like limbic reptilian way just respond. But if you can
Hmm.
be in a calm enough nervous state, um, you can regulate and pause and then take a deep breath or think. Um, so in that case, when your partner comes in and says something really nasty or some surprising or mean, you can kind of pause and take a deep breath, hopefully. And I guess one direction we could go down is all the holistic things you can do to put yourself into that state and to give yourself the best chance at responding in a good way, which I believe strongly in. Um, and then secondly, another path I'd like to briefly go down with you is like, and see how we're doing on time. How do you recommend folks to deal with big stressors? You touched on breath work. You touched on, is there anything else like interpersonally that you help folks self-regulate in the moment when they're in such
Yeah.
tough dynamics?
So if you've ever heard of DBT, dialectical behavior therapy, that's exactly what that is. What do you do right now in the moment when there's a strong emotional reaction to cope? Okay, so it's really
That's
common
what
for anger
dialectic focuses on.
management, trauma. Yep. Trauma work, anger management, chronic suicidal ideation. You name it. If you're having a strong emotional reaction, triggers to substances. How do we get our body in a calm state now? And so, sure, breath work is part of it. We know this because we're calming our central nervous system. We're creating that space. The use of cold temperature, I cannot say, or I cannot stress enough. So it's another way to calm your central nervous system. So if you go, let's say, hold ice cubes, jump in a cold shower. Remember that old saying, like, calm down, go take a shower, go take a cold shower
Hmm.
and chill out or something like that, right? Because the cold temperature is actually calming your body. It's lowering your blood pressure. It's lowering your heart rate. So when people get elevated, they're breathing more shallow, more narrow. You have increased blood pressure, increased heart rate, right? All the other physical symptoms start. And I think that just makes it worse and exacerbates what you might be emotionally feeling. And so if you use cold temperature to just calm that central nervous system, and so drink some ice water. If you can't hop in a cold shower, can you always carry ice water with you? Of course, breath work. Sure, there's a focus on tapping. There's even havening, which is using opposite hand to opposite arm while you're thinking about the stressful situation, and you continue to do this until you self-soothe yourself out of it. Grounding techniques are so powerful because it brings you to the present moment. And so if we're triggered, we're probably living in the past. If we're anxious, we're living in the future. And so how do
Hmm.
we bring our mind back to right now in the present moment? And so one of my favorite grounding techniques that I tell every client I've ever worked with is state the date, state the time, state where you
Hmm.
are, what you are doing right now, and what you are doing next. And just keep it very, very focused here. And sure, there's tons of other grounding techniques out there too. The 5, 4, 3, 2, 1 that I'm sure you've heard of, like name 5 things you see, 4 things that you can touch, 3 things that you can hear, 2 things you can smell, 1 thing you can taste. How do we perceive things? Through our 5 senses, right? So if you can use your 5 senses to bring you to a calm state also, and back to the present moment. So that's another coping skill. I mean, the list can go on and on. I have tons,
Hmm.
but DBT is just more grounding and immediate. Another thing of DBT that I love is called opposite action. So as we were talking about, what you think about directly connects to how you feel. So if you're really angry, how do we interrupt that anger with humor, which would be the opposite emotion? Can you watch like a really funny Kevin Hart stand up? Can you,
Hmm.
watch cat videos on YouTube or something that's going to change that feeling immediately? So you're distracting from the anger, but you're also doing something intentionally to create a different emotion.
Hmm.
Um, and then, of course, anything physical. So DBT is always physical. So if you're pissed off or you're having a strong emotional reaction, go do 50 burpees. Like you're probably not going to make it to 50, and that's the goal, is that you're not going to make it to 50, right? We want you to go above what you could probably do. Maybe you could do 50 burpees. I hate
Yeah,
burpees. They're
maybe.
they're intense, right?
Well, I'm in
Jumping jacks,
Florida,
push-ups, whatever. What can you do?
If
What
we
can you
gotta
do
come and do
right
burpees, that's
now?
fine. Uh-huh.
um, to just have an outlet and redirect, distract.
Those are killer modalities and tools. Thank you. I mean, just those
Yeah.
7 are like awesome, and many of which I haven't heard of. And I'm sure folks out there, yeah, maybe I've heard of some. Uh, I guess my last question for you, Nicole, and I know we're running up on time, and then I'll ask you where
Yeah.
people can find you. When when somebody is skeptical that any of these lifestyle things, like these tricks, these modalities, woo woo, these energy, these, I don't know, I just like to go watch TV and drink a beer. How do you help someone move from that place, because they're seeing you for a reason, to a place of like openness to new tricks, habits, tools, modalities, practices, you name it?
Yeah, so I'm really direct, right? So if someone's coming to me, hey,
Jersey.
you're here for a reason. Yeah, there you go. Let's talk about it for a reason. I've once been told I'm the Braveheart version of a counselor, not to scare people away, but like I'm not gonna tiptoe around what might be happening. I'm gonna do it with respect and empathy and therapeutically. So therapeutic confrontation, as I mentioned before, but um, what's the worst that can happen if you do something different? Because what you're doing is not working, right? So what
Mm,
you're doing is not working. So nothing changes if nothing changes. So I try to motivate people by building discrepancy. So you tell me you have all these goals and you're unhappy with the way things are in your life, but does that match the actions? So like if you have these goals, but this is the actions that you're taking every day, do they match? Do you think you're going to get to that goal? No, you're not. So what do we need to do differently to actually get you here? And so you just kind of call them out in a very supportive, therapeutic way, while also understanding, listen, I'm a skeptic by nature too. I always was. Even when I was being trained in accelerated resolution therapy, which is specialized trauma therapy technique, we didn't even really get to talk about that, but it is a non invasive way, really, of and gentle approach to resolving trauma this in the session. Um, but
you
when
want
I
to
was
touch on
even
it
being
or
trained in that, sure, we can. I have time if you have time,
yeah.
but
Yeah.
I literally was skeptical about that myself. And I had to go
Mm-hmm.
through the process to prove to myself.
Mm,
So I had the therapy done on me and was like, okay. So I think I understand and relate to people that are skeptical, but I say, what's the worst that can happen of trying something new? um, and then helping them see their role in their distress. So, for example, this is a common thing I'm sure you hear and that we all hear is people complaining about someone specific in their life. That person that you're
mm-hmm.
spending your time and energy complaining about, it's not that person. That is telling you you need to set a boundary in your life. So, what can you do differently
Mm,
there? Look at how you can set a boundary. So, if you're in constant distress because of this individual, what can you do differently? What's within your control? And that's why I'm saying we empower people because we want to help people realize you're not a diagnosis, you're not a symptom, you're not a victim. What is
yes.
within your control that you can actually do differently to help decrease some of the distress in your life? And then also facts, right? Like, if you don't want to believe me,
Mm,
I'll send you stuff. I'll send you the research. I'll
mm-hmm.
send you resources. Look at it yourself and tell me, what do you think about this? Do you agree? Do you disagree? But then also allowing space for someone to disagree, right? I'm not the expert on your life. Like I said, they
Mm-hmm.
are. So if that doesn't resonate with them and that doesn't work for them, cool, let's try something else because we will find something um, that will help you.
Mm-hmm. So discrepancies, facts, being direct and honest, but empathetic, therapeutic confrontation, which I love, and yes, putting empowering control, right? I mean, you generally don't want to see people as mentally ill. You want to see them as, yeah, maybe experiencing some issues, maybe some trauma, maybe some disturbances, but controlling what they can control. And I'm fully with you on that philosophically
Yeah,
and personally. I'd love to touch on the trauma piece another time. Let's do a round two, and
sure,
we can go into like
sure.
really specific
Anytime.
on trauma because I think that was just such a powerful stopping point, really, that let's end it there. Nicole
Yeah.
Del Paoli, where can people find you? I know you're practicing in and or outside of Tampa, so you have some in-person seminars and workshops, which are really cool. What website can people see to find those, and where can people find you on social?
Yeah, so womenempowermentcounseling.com is the website and Women Empowerment Counseling on Instagram and YouTube.
Awesome. We're gonna link those in the notes. Thank you so much for coming
Cool.
on, for
Yeah,
going with
thank
me on
you.
this journey back and forth and sideways and forward. All right. Awesome job.
Yeah,
Bye.
thanks. Bye.